Good evening, everyone, and a warm Love City welcome to all. My name is Aliyah Lockhart, and I am the program manager for the Morris DeCastro Clinic on St. John, and I will be your host for this evening's town hall. This evening's town hall is intended to share and discuss with you our plans for the rebuild and redesign of the Morris DeCastro Clinic. As we all know, Morris DeCastro Clinic has been and still is the local community access point for public health care. And the intent with the redesign is for it to remain a focal point for access to the array of Department of Health services on St. John available to St. Jonians. For this evening's town hall, our presenters are Justa Encarnacion, VI Commissioner of Health, Rosalinda Brown, Director, Public Project Management Office, Department of Health, and Springline Architects, Gilbert Laban and Jerry Taino. Also joining us this evening are members of the VIDOH leadership team, led by Commissioner of Health Justa Encarnacion, Assistant Commissioner Dr. Nicole Craigwell-Sims, Assistant Commissioner Ruben Malloy, Deputy Commissioner Janice Valmond, Chief of Staff Shanna O'Reilly, Rosalinda Brown, Director of our Project Management Office and our Project Management team. Also joining us is our Director of Communications, Christine Lett. We will commence this evening with our presentations, followed by a question and answer. Each attendee will be allowed one question. Then we will take questions from our Facebook Live. There are a lot of people in attendance, which we're very happy to see. However, we ask that you keep your questions to one question with a follow-up. We respectfully request that questions are concise so that we can facilitate the maximum level of engagement possible within the allotted time frame. And we look forward to hearing feedback. Without further ado, I'm going to introduce our first presenter, Department of Health Commissioner Justa Encarnacion.
I like that. A happy, love, city strong. Welcome to all of you. I just stole that from you. Good evening, everyone. Good evening. I am honestly happy. I love St. John, so I'm happy. Shanna could tell you this. I'm always happy to come over to St. John. So you've met my team. AC Malloy, Assistant Commissioner Malloy, has actually been very engaged in the project management process for several years now, and actually started the PMO at Department of Health. So just want to make sure I recognize him for all the work that he's done in this as well. But there are other people in the audience. Before we start, I really want to recognize also, and it's your very own Shakima Sproul that's here. And she's not singing tonight, okay? But she's definitely here to, just like you, hear and see what's happening, and of course, ask the questions. And of course, from the governor's office is Tasha Dorset. Tasha, thank you so much for being here. Policy advisor for health, hospital, and human services. There you go. Okay, so just to let you know, we are happy that you're also here, because in order for us to continue doing the projects, we have to be able to ensure that, one, you know what's happening, to keep you engaged, keep you informed, but also to get some information from you. And this is what tonight is all about. For you to be able to hear what's happening, ask questions, and feel free to ask the questions. Of course, you've gotten some limits as to time frames and stuff like that, but we are here because of that reason. We want to make sure that you are comfortable with what we're doing. I have to say, though, I love this project. When you see it, I don't want to brainwash you. I fell in love with it when I saw it. They have done an awesome job with this. So I'm really looking in for it. We're going to share our vision, but our vision really and truly should be your vision. And so that's really how we want to look at it. Where we are right now is where we're going to stay. And the reason why we're doing that is because we want to make sure that no matter what we do, everyone living on St. John has the best access to care that they can possibly have. We're maintaining that location, and you'll see it, but I'll say it now. EMS is there with us. We have partnered together, and we are staying as partners, and EMS is there, and it's very important to have access to that, especially emergency services. So those are some of the things that we've taken into consideration. You're going to hear me speaking a little later in terms of not only access to care, but how we enhance what we already have available. We know that some of the services haven't been available to you, but we want to make sure that we not only say that they're going to be there, but provide a venue and a means in which you can actually see and take advantage of what we have to offer. And really and truly, the key is to engage in and providing and supporting stronger, healthier families, individuals who live here on St. John, native to St. John, those that visit, those that are passing through, and those that come here and feel comfortable here and want to come back to live in the Virgin Islands. So I'm going to now take an opportunity to turn it over to the key project manager on the team, Rosalinda Brown, and she will give you a little bit more information as to what's going on, bring some history also to what it is. And you guys may actually know, we're going to test you at the end, okay? So just listen out. But you probably know a lot of this, but she has some information she's going to share with you. Thank you, Rosalinda.
Thank you, Commissioner. Good evening, everyone. So I'm so pleased to be here to provide an introduction to our Division of Project Management and Capital Projects. So the primary role for the Project Management Office is to provide oversight for all of our disaster recovery and capital projects within the Department of Health. Our key responsibilities are really the baseline management. We want to ensure that the projects are completed on time. We want to ensure that we have enough funding to complete the projects, right? So budgeting. And then we also want to ensure that we collaborate with all of our key stakeholders, which includes you, the community, other federal agencies such as FEMA, other government agencies such as the Department of Public Works, the Office of Disaster Recovery, and as well as our subject matter experts, which are the design firms and the construction firms. But primarily, we want to focus on infrastructure management because we want to ensure that our facilities are resilient and remain sustainable to serve the community. So on our next slide, I'd like to provide an introduction to the core Department of Health project management team who will be dedicated specifically to this project. So we have our main project manager, Ms. Talisa Griffith-Simmons. We have our project analyst, Mr. Kyle Hansen. Our construction manager, Akima Edwards, who is here with us. We also have our financial controller, Ms. Danaja Dowdy, and our project coordinator, Ms. Everny Mota Ramos. So we have recently partnered with Springline Architects on other projects that we have been extremely successful in. What you see displayed on the screen right now is a Nude Hansen Wick project, which is, I'd like to note, the first rebuild for the disaster in the St. Thomas district. It is a new, over 5,000 square foot building that focuses specifically for women, infants, and children. It's a modern, state-of-the-art facility dedicated to women, infants, and children. Additionally, another project that we recently completed is phase 1 of our Wick Frederiksted renovation project. Again, that was designed by Springline Architects. So we really have a close-knit and established relationship with Springline Architects. They do understand healthcare and bringing that in, incorporating it into our facilities. I'd like to note that the Frederiksted project was also within the historic district. And I'd like to bring you back to some history for Morris DeCastro. So the Morris DeCastro building was initially built in 1953. Of course, it was named after the former Governor Morris F. DeCastro, and he was the 5th appointed governor within the territory. Some key focus areas that his administration focused on, similar to the current administration, are the development for health, housing, education, roads, as well as the expansion for tourism. He is best known for, if I fail, you fail. If I succeed, you succeed. So we'd also like to note that Morris F. DeCastro was a pioneer for healthcare facilities. So he's established Morris DeCastro Clinic on the within the St. John district. In the St. Thomas district, he had established the Nude Hansen Hospital, as well as the Pearson Gardens Clinic. And on St. Croix, he established the Ingeborg Nesbitt Clinic. Okay? So just a little history there of Morris F. DeCastro and why it's so important for us. And just bringing you back home to why we're here today, it's about the Morris DeCastro Clinic rebuild. So the existing structure is 5,500 square feet. And this structure was impacted by Hurricanes Irma and Maria. And so we went through a vigorous process that I'll share on the next slide, just to provide an overview in terms of what took us so long, right? So we were impacted by Hurricanes Irma and Maria back in 2017. Through 2018 and through 2019, we went through the FEMA application development process. What does that mean? We actually submitted dimensions, descriptions of all of the damages that were within the facility that were impacted initially from the storm. We also had to provide all of the supporting documentation such as photographs, maintenance records, and anything that could justify our case. Now from 2020 through 2022, FEMA went through all of the documentation that we submitted. It's actually a 22 process step program for the FEMA public assistance application process. And we went through their review. We were initially denied for a full prudent replacement, and then we were able to overturn that decision, thankfully, and FEMA granted us and awarded us, finally in 2023, a full replacement for the facility, which was $17.5 million. So just to demonstrate where we are right now, since we have been awarded, we have negotiated our contract, and the Office of Disaster Recovery has issued a task order for Springline Architects to proceed with the design. So the notice to proceed was issued earlier this year in January. We began working with Springline Architects, I would say, late February, March, developing the projects. So what we've done so far is we've completed all of the preliminary programming data, which means that we met with all of our healthcare experts. We collected all of the requirements for each specific space within the clinic, and then also noting spaces for expanding services and expanding the square footage as well. We've also completed our initial hearing introducing the project to the State Historic Preservation Office, which we did receive a favorable review to proceed. And so our next steps is really finalizing the preliminary concept, and that's why we're here today, to get the input from the community before we finalize the concept and we go back to the State Historic Preservation Office and present the official concept. And of course, hopefully being granted approval to proceed. So without further ado, what I'd like to do is turn it over to Mr. Gilbert Laban with Springline Architects. He will be providing an update on the new structure that is projected to be 11,000 square feet.
Good evening, everyone. First off, I just want to say thank you for the audience and thank you for everybody listening online as well. My name is Gilbert Laban. I am the principal of Springline Architects. In the room today that's also going to be doing the second part of this presentation is Jerry Treno, who's also a principal, and we do have Harrison Knight attending as well, who's one of our project designers. Just bear with us. If you could just start at the very beginning. So this presentation that you see on the screen currently, this was some of the documentation that we presented to the State Historic Preservation Board to at least get them up to date on where we are with the project and some of the due diligence that we did providing to get to this design. So if you could switch to the next slide. What you see here, this is an existing boundary survey of the site. In this location, this is the existing Morris DeCastro Clinic today. Over in this area would be Cruz Bay. Up here would be the Battery. And then these are the other buildings coming around to the east of the site. Here we've got Franklin Powell Park. And essentially, like Rosalinda said, we are going to be demolishing the building incomplete and rebuilding on that site. Now, this is just showing just the area of demolition here. And one of the things that I wanted to kind of point out is some of the due diligence that went into the project. So being that we are demolishing this building, we have to put back a building that's going to meet, first and foremost, all of the VI zoning requirements. Secondly, meet all of the state historic preservation guidelines. And then ultimately, this building will be designed to the 2021 IBC requirements. So starting first from a zoning perspective, this project is zone P, public. Under the P designation, it really doesn't have any requirements for setbacks, side yards, or lot occupancy. But where it does have one designation is that we are required to meet the height limit of the adjoining zoning parcels. On this side, you have B1, and on this side, you have W1. Due to the W1 height limit of 3 stories, we have been allowed now to design a building to meet that code requirement. The other thing is, on top of that, there's also the requirement for off-street parking. So that was something else that we had to consider in the design and why we're going to design ultimately a 3-story building. Some other considerations is that we are in the floodplain, so the building needs to be elevated a couple feet above what it is currently today so that we're not going to have any flood issues. If you could move on to the next slide. So what this slide is doing right now, what you see in the pink area, this is the delineation of the historic Cruz Bay district. What you see in yellow, this is our current site, and then what we've outlined in the purple, these are other parcels or properties that currently have 3-story structures existing today. So this is just kind of an overview now of the site with the current design overlaid on it. Of course, you can see the cruise dock terminal here, Franklin Powell Park. This is the new footprint of the building itself that's shown here. And then, of course, you've got the battery off to the page, the top part of the page. So what these images are just really showing you are some of the existing conditions today. This is an aerial view from the dock. This is the Morris DeCastro Clinic that you can see right here. This view right now is from, let's say, kind of the parking lot across the way from the existing park. This is a view now coming off the dock, looking down Congans God. And this is a view from the historic battery looking back at the existing building as is today. And these are just some additional aerial views that we wanted to show, just different components of the building. You see it from bird's eye view, and then some of the other views along the way. So at this point, I'm going to hand this off to Jerry Trano to continue the presentation.
Thank you, Gilbert. Jerry Trano, principal at Springline. Along with Gilbert, I've had the pleasure of leading a great design team and went through a wonderful collaboration over the past few months with Department of Health. And as Commissioner stated, I think we're all very excited with the vision that is starting to form here. And so, we welcome compliments, but we also welcome critique. And that's kind of what we're here to do this evening. Sometimes the computer makes things look more final than they are, but please treat this as just a concept that we're going to refine with the next few months and take it to a final point. So again, your input will help us do that and come to a place where our goal and our vision is that the community of St. John and Cruz Bay in particular ends up with something that they can be proud of and celebrate for years to come. That's our ultimate goal, as well as service the Department of Health and the community with all the services it provides. So that being said, I think Gilbert kind of set up the context well, so I'm going to jump right in and start going through the layout of the building and how it orients to the site. This is the lower level, and so we were able to fit code minimum parking within that footprint of the existing building of 12 spaces, plus the EMS vans that require 2 equal 14 total. We were also able to fit a colonnade along Storkongensgade Road that will strengthen the pedestrian connectivity of that area. It connects Franklin Powell Park over to the Battery from a pedestrian standpoint, gives respite for sun and rain. So we were able to create an amenity along that facade on the ground floor that buffers the parking as well. We oriented the main entrance to along the park side, facing the waterfront, so that it's a celebrated entrance. It provides a potential identity for the Department of Health in this facility from all perspectives, both from the approach by ferry or the water, also from the street, and really everywhere that you kind of experience this building. I guess 2 main points of entry off of Henry Samuel Street and Storkongensgade for vehicle as well. And the rest of the building, as you'll see in the elevation, is going to be open air, so some type of nice ironwork or fence or something like that also will allow this to all breathe and potentially connect during events for the community. Next slide, please. Oh, there you go. As you go up, this is the story above parking, main level. You can see that we use the opportunity along that waterfront to put a lot of glazing and glass, and we have an opportunity to really create an ornate building facade that will allow a lot of light in and views out for the interior as well as look good on the exterior. We put waiting area and check-in and just basically public space. The rest of that floor is all clinical space, which Rosalinda explained. And lastly, the 3rd floor is mainly administrative office and support space. A couple other things that I'll point out is you can see these white areas here and here. We've stepped the building on the 3rd floor back in an attempt to soften the facade of that 3 stories, mainly along the street side, but also along this side where we've got some other buildings and neighbors to kind of, again, from the street and from the eye level perspective, soften that kind of building mass a little bit. Next slide, please. Oh, the other way. So these are 2-dimensional elevations. This is the waterfront, as you would experience the building from the waterfront. You can see that step. We're envisioning a rooftop terrace on the top of that, so it also can be kind of a place for carnival and other events, a place that you can interact with the street side from the top. But as we get into the 3D views, you'll see that this 2-story mass really softens the building. And that's really what you're going to experience primarily from the street below. Yeah, this is fine. We can get into 3D. So this is a bird's eye axon of that. You can see the 2-story step, all the glass, the entryway. The elevator needs to be taller, so we use that opportunity to kind of create that tower element and give the building its identity for the Department of Health. And then as you go around the building, on the Battery side, that stair, we made an open stair. We're proposing an open stair, which kind of gives that feeling of front porch and openness that Cruz Bay has in its character of all its buildings. And these are just more 3D views in context, photographic context, showing the character of the waterfront of Cruz Bay. Again, the diagram that Gilbert presented, 3-story buildings over here and then right at the pier base, and we're just kind of continuing that trend along with this move with Franklin Powell Park right there at the pier head. And you can see this is probably the most representative of what you're actually going to experience from the street. It's primarily a 2-story building with this 3-story step back. The main entry point out off of the pier has a large tree canopy. So all of this is going to be greatly buffered in context with those tree canopies. So very variety of different experiences that you're going to get this building from. Just trying to to explore those. That's the end of the design presentation. Hand it back over to the commissioner.
I hope you guys are liking what you're seeing. So one of the things we're going to speak about is also services now. And we spoke about access to care. And of course, right now, DeCastro has many of the services that we have on St. Thomas as well as St. Croix. However, there are a lot of times it's not consistent, right? Right? Okay, I feel you, I hear you. I'm looking at your eyes too, right? Okay, good. So the focus is not just to have the building, a beautiful building, but for it to have a purpose. And so that is really the goal. Increase staffing, ensuring that we delineate what the services are. Behavioral health is one of the ones. Mental illness is really and truly so high within each of the islands in the Virgin Islands. So that's one of the areas to really and truly is one of the biggest areas. It's on the second floor, and one of the biggest areas, easily accessible. And looking forward to having some access down on the bottom so that you can communicate with someone before you even go up on the top. That's one of the first things. Looking at chronic disease, how we're focusing on chronic disease. We spoke about human resources, having the number of staff that we need on a consistent basis. We're actually going to have someone stationed here as well consistently so that they too would be able to manage what's going on down here and what the staff. Aaliyah's here, she's doing an awesome job, but we want to make sure that we have training for these individuals. So there's a lot more that's going to be happening here on St. John that has never happened in the past. Okay? So those are some of the things that we're looking at. We're looking at, that's the ground floor, we spoke about that, the second floor, main entrance. Okay, looking at now the parking level. You notice that we spoke, and I said before, we spoke about having the 2 areas for the ambulances. So it's 12 parking spaces plus 2 for the ambulances for 14 parking spaces. Doesn't look like it's going to fit that, but truly it's very spacious, so it will. And like I said again, having an ambulance base right here is critical for safety to the people of St. John. Some of the areas that we're going to be focusing on, I spoke about behavioral health, communicable diseases. Jason Henry would be proud of me. 340, getting to zero. That's a slogan for us in actually reducing HIV within the territory. And we really need to do that because we continuously see that cases rise every year. And so we always have one of the highest per capita cases of HIV within the nation. We're trying to reduce that. We're trying to get to zero. And that's the goal. Chronic disease and prevention, diabetes, hypertension, cardiac, cancer, behavioral health is a chronic disease. All those things we're going to be focused on in a different way. Dental office, we have a dental office there now, but it's not used. The key thing is have a functioning dental office where Dr. Hunt and I are working closely with Dr. Griffith to make sure that we can bring dentistry back into public health as well. And because I don't care how many dental spaces you have within a territory at this point, you still have a waiting list. And I'm sure that you guys experience that. So having one here in St. John is going to be beneficial to everybody. The EMS regulatory, we spoke about that. We spoke about EMS. The Department of Health serves not just as the regulatory, but it also, then that's state, but also local. Local has to do with the clinics and the type of services you have. But the regulatory piece is, or the state piece is the regulatory piece. How do we actually monitor? One of the things that you often hear, and I get the calls, we don't have anybody to give us food handler's card. Environmental health is regulatory. So having human resources here, having full access to a camera at all times allows you to get your food handler's card here on a prompt basis so the communication continues. Maternal child health and infants and toddlers. Right now we actually have telehealth services. I don't know if you are aware of that. We have telehealth services in DeCastro, more so linked with MCH, but it can actually be done through any division within public health. So that's critical because you don't have to leave to have telehealth services. It can actually be done right here. And of course, women, infants, and children, this is WIC. something that we know is near and dear to our hearts. And we have WIC right now, and I know that you see her because she goes out to every clinic that you have over here or any function, and she has her plate, and she wants to make sure you are there, and you have your vegetables in one way and your fruits in another way, and your meat and your starches. And so that's all the beginning of how we actually reduce chronic disease within the territory. Some of the other areas, the third floor is going to be, of course, the administrative suite. I spoke about environmental health, financial services, human resources, health information technology, telehealth offices, collaboration room and conference room and storage. So that's on the third floor. But I know that your main concern is what's happening on the second floor in terms of clinical services. So those are some of the things that we're going to be looking at. Right now, what we're going to do is we're going to open up the floor, and Aliyah is going to be with me as well, but making sure that you have an opportunity to ask some questions. First of all, thank you for being here. Thank you for listening to what we have to say and being able to look at what hearing is one thing, seeing is the next. So now we have an opportunity for us to stop and listen to you and what you have to say. So be kind to me, okay? Is there any, are we also taking, okay, ma'am?
Good evening, everyone. I'm Megan Enright. I'm the director of Love City Strong. This is really a process question for Department of Health. Currently, anything above a Category 1 hurricane, Myra Keating, relocates to DeCastro. And obviously, this is a sizable project to undertake between demolition and reconstructing a 3-story new structure. What are the plans for the clinic while the construction is happening? And have you made a plan with Myra Keating to figure out where emergency care will happen when there's a storm?
Not just emergency care, but actually just clinical care altogether. So I'm going to have Rosalinda come up and answer that question because she's actually working with areas. So we want to make sure that we find the best place, the safe place for that to happen. But we've spoken about that.
Thank you, Commissioner. So we've explored numerous options, and of course, because of the hurricanes that we're impacted with, right? We want to make sure that we go into a brick and mortar building and that we're not just going into a modular facility. So we haven't, to be honest, we have not identified a specific site, an area. One of the challenges, of course, within the St. John district is limited options, and with the funding sources that we have, the funding is limited in terms of a construction build out. So we're looking for a space that is brick and mortar, but then is also somewhat built out so that we can pursue a clinical function within that space. So we're actively working on that.
Rosalinda, Rosalinda, could you let them know that one of the things that we're doing, first of all, Myra Keating is also going to be renovated. I think they got prudent replacement as well. So we're going to be working together to make sure access to care is not decreased around that time. But from a timeline perspective, we're looking at a year to begin this project. So we have time to be able to really focus and speak with individuals and find the best place to have everyone. So it's not going to be like next week. We have a whole year to plan. Okay?
We would love to stay up to date on that process.
Say that one more time.
We would love to stay up to date on that process.
Well, I think that this is one of the best ways to do it is by starting. And tonight, we have started. My pleasure.
Good evening. Whoa.
Good evening.
I thought I had power. I have a question really about the overall approach to the project. Considering the fact that the Julius Ross School is moving and this will be vacant land, was there any consideration at all of not rebuilding such a scaled structure in the floodplain? Did you guys consider maybe renovating the Clarence Thomas Annex, which is currently vacant, or maybe possibly demoing and rebuilding a section of the school?
We actually looked, I can't speak about the school right now, but I'm sure that someone else can, so they'll come up to do that. But what I can say is that we have looked at 3 different areas outside of the school, and the footprint didn't give us what we needed to be able to give the services that we need to provide. But when you come up and speak about the others?
Good evening again. Yeah, we work closely with Department of Health and entertained other options, but I think one of the things to note is that the FEMA grant is assigned to this property, and it would be a refunding, if you will, process, that would have no guarantee of success, that we could get the funds that they have been obligated assigned to some other property. They don't have control of any of those other properties, so there's no guarantee of success of gaining control or the timeline to do so, and the funding has an expiration date. And so when you start looking at all of these things, there's just no clear path to success, and the risk is very high in not moving forward with them for getting a project done, getting the care to the community that you so desperately need. So that's really why I think Department of Health decided to move forward with this site, because there just wasn't any other option that provided a clear path for success.
And I'll just like to elaborate a bit further that this project is also part of the USVI Rebuild Initiative, which is currently being managed by the Office of Disaster Recovery. And so not only will the Morris DeCastro Clinic be included, but also to your point, Mr. Marsh, the Julius C. Sprague School, and then also the Myra Keating Clinic is all part of the bundle. And I think the approach right there is just looking at timelines and moving forward expeditiously, right? And ensuring that we have a contract awarded by 2025, but then also to the prior question, just making sure that we've identified the temporary spaces so that we can ensure that the continuity of operations.
So when did this process start? Because we're looking now 6 years or so out after the storms. When did you start to look at other properties? Because these are properties controlled by the central government, and so I imagine that there could have been an easy conversation. Would have the governor chat with PNP and education, and you do a swap. They've done it several times for other projects. So it's hard to accept that timelines is the result or the answer. Because I feel like if these conversations were happening,
I like the conversation that you're having. Let me ask the question back to you. Tell me, what is your concern about where it is right now? The school is being moved because it's in the 100-year floodplain. The school is an educational facility. This is a community health facility, and it serves in emergency exercises. So I imagine that if the federal government is looking at the school and saying, this is too low down in the floodplain, I'm trying to understand why an emergency facility is being built lower down in the floodplain and right on the waterfront. I'm trying to connect all of those dots. Well, one of the things I know for sure, and that's a good question, so thank you for that. One of the things, and once someone mentioned that Myra Keaton actually comes down here. Lo and behold, this is one of the safest areas, and it's hard to say as to why, but it had actually shown to be one of the safest areas. After the storms, Myra Keaton stayed here for actually, I would say, close to a year or so, because when I started, they were still here, and that was in 2019. So that's one of the things. What we're going to do is that, like we said, we're pulling information on all the answers that we have right now, but we're going to pull information from you like we just did, and then we'll be keeping you in touch like you asked, so that we come back and see where we can, if changes can be made. But those are the discussions we're having right now. And like we said, time frame is one of the things that's key. But thank you for your discussion. Appreciate that.
Thank you for the presentation.
I just want to touch on his point. Oh, sorry. Hi, I'm Shani Strauss from Office of Disaster Recovery. To touch on your point, Julius Sprague is not being relocated due to the fact that it's in a floodplain. They're trying to expand, so it's not going to become a K-12. So yes, the fact that it was in a floodplain was a concern, but we want to expand the site, and that's why moving to the new location will assist in that, assist in that effort.
Yeah, but it has to be moved in order to spend the money.
No, it doesn't. So.
I worked in ODR. I tracked that project. I know the details. But thank you for responding.
No problem.
Yeah. And then we'll pick it up, because when we come back, we'll be giving updates as well. So thank you, Ms. Rose, for that. We appreciate that, okay?
Hi, good evening. My
Good
name is
evening.
Lorelei Monsanto, and I'm going to kind of blow up the room right now. I hate that building. Me, personally, I hate it. I think it's too big for that corner. And come on, St. John's, I need to open up our mouth. Say it. Tell them.
So rather than me answering that, because I honestly love the building, what I'm going to do is, first of all, thank you, because your input is really important to us. Rather than me answering, I'm actually going to turn it over to the architects, because the way that the building actually looks from that scale it's going to be a lot, how you look at it a lot differently, but I'm going to actually let the experts answer rather than me answering. But no comments coming from here are bad comments. We need to hear what you're saying.
Okay, can I finish my statement? Because she said to make it concise when she said,
Yes.
right? I want the architects, and you as well. I don't know if you all have been here during season, when we are flooded with a mass of people driving around that corner to get picked up by taxis or car rentals, villas, whatever. It's madness and mayhem. And we keep talking about keeping these ambulances in that area. I think there's more risk than harm being done, because you're trying to compact all of this stuff in the same place. And you're changing our whole infrastructure. Like, I know we already have the South of France on this side. I understand that. But I think this building is a bit large for the spot. Thank you.
One of the things, and I'll turn it over, but looking at the footprint, I think that one of the things that it gives us an opportunity to is really and truly look at how the footprint is going to look, not just today, but years to come. But I'll let you speak more about what we've done to ensure that it doesn't look as large as it is, and some of the things that we're getting. Jerry, thank you.
Thank you for the comment and the question. I just want to show how we're improving the situation, actually. Currently, there's just a sidewalk, and there's no ability to move on and off the sidewalk or away from the traffic, and we're giving you a full 8-foot wide, it does taper down, but 8-foot wide covered pedestrian way to pull back away from all that congestion and traffic. That doesn't exist now. So that's a benefit, that's an improvement. We're putting parking under the building so that EMS vans can get off of the street and away from that congestion, along with everything else. We're putting parking on the site that doesn't currently now to relieve the stress on the public parking lot next door. So just from all the concerns that you said on the street level and all the activity, we're making many improvements. So the size of the building and the feel and the scale, I mean, I think that's something that we can debate, but I just wanted to make that point that we're just making nothing but improvements on that first level. And then again, as you go up, we've collaborated with HPC. They suggested that we step the building back, tier the building back to soften that experience. We're doing all those things, and we're trying to develop this in a way that you experience it more like a 2-story building than a 3 from the street. So that's just kind of a perception thing and a feel. And the size of the building is grown programmatically, but I don't think we see the traffic to and from the building increasing much. It's just going to be a matter of, being able to provide all services at all times. Sure.
You haven't experienced the gridlock every time the ferry comes in, right? Have you been here during gridlock time, which is constant? And you're putting it right next to the post office, where we can't even park now. There's a parking lot, but try and find an empty space. I mean, the building looks lovely from the inside, everything you have planned, but to me, aesthetically, it's too big for the proportion of where you're putting it. And I would think, wouldn't it be ideal up where Myra Keating is? I mean, you've got a lot of spaces dedicated to offices and people that need to park their car. I mean, there's something wrong with this.
Thank you for your feedback.
Sorry.
Now, over here, and then I'll be coming to you, okay? Tell us your name, okay?
Good evening, Carmen Wesselhoff, Hedrington. I love the building. The concern about the traffic and all of that is a concern for the whole of downtown Cruz Bay, not just downtown by the park. Even if you put it up by the Clarice Thomas Annex, there's still traffic. The whole of downtown Cruz Bay has outgrown, overgrown, however you want to phrase it. I love the building. It's time that we have something that we all can be proud of with the services that you're offering, and I think we need to embrace it. No matter where you put it, you have Wharfside Village, just put a 3-story hotel. You have Granby round the corner, a 3-story hotel. Nobody ain't fuss about what's going on in Wharfside Village with all the water running in the road and all the problems that we have in. So we need to embrace it and find the best way to make it work in the downtown area. Cruz Bay has outgrown itself. So what are we going to do? That's why we should have planned better before, but we're here now, so we need to embrace it. Thank you.
And that's why we're building up, so that, right here in purple.
Yvonne Wells, please excuse me for sitting. I heard the word plan, and that's where I'm going. Recently, we were doing charrettes, working with DPNR. They're getting ready to come out with a comprehensive land and water use plan. And I was wondering, how does this interface with that process? Because I believe, if I'm not mistaken, I was hearing at that time the proposal for walkability within Cruz Bay and no traffic. If that building goes up there, are we saying we're going to be continuing with the traffic? Are we working together in tandem, or are we, or are you not aware, your agency not aware of what DPNR is coming up with?
Of the $60+ million that DPNR has gotten to save our yes, I'm quite aware of that.
You know,
but I like your point. I'll let you finish and then I'll start.
No, it's bothersome to me.
Yeah.
Because it's like, are we going around in circles?
No, I understand what you're saying.
And I agree with the fact that the place is congested as it is. I don't necessarily agree with moving anywhere up to where Myra Keaton is right now.
Okay,
you know, but something gotta give.
Excellent point. So one of the things that we spoke about is we made a list of departments, agencies that we actually have to make sure we sit down with and have discussions with. So DPNR was actually one of them that we spoke about. So we will be meeting with individuals. Like I said, we have a whole year to plan. So we're going to be pulling them out, having select meetings, having individuals in those meetings that, that can provide the feedback like what you're given. So those are some of the things that we're doing.
I'd just like to provide clarification about the difference between Meyer Keating and the Morris DeCastro Clinic. So Morris DeCastro Clinic is more focused on public health, right? Our response and our approach to public health and public services. For the Myra Keating Clinic, they're a private, right, entity. So they're government entity, but they're more focused on services, right, that cost significantly more than a public health perspective. Another item that we spoke to Fire EMS on was ensuring that we remain accessible in the event of an emergency. So maintaining the exact location right now to ensure that we're accessible so that we can be responsive appropriately, that's one of the items that we considered initially.
Just a little clarification. With Myra Keaton, it's actually acute care versus the more preventive care that we would give. I just wanted to make sure I give that clarification so everybody have but you guys know what most of you know what goes on with Myra Keaton because that's where you go for a lot of your emergency care. Any questions from Facebook? That's on Facebook? Yes.
This is a question from
That's an excellent question. I feel like I live dialysis. That's one of the things that, well, let me just let you guys know, right? Dialysis can actually be, as long as we have the correct water system for dialysis and piping, we could do dialysis in a lot of different places. Right now, dialysis is not one of the services that we have set to in Morris DeCastro. It is definitely something that we've been speaking about for Myra Keaton, or actually to actually have it on St. John, because so that everyone receiving dialysis care, two things, doesn't have to go over 3 times a week, or doesn't have to leave when there's a storm coming and you have to get your dialysis before you need it, because you want to make sure that you're healthy for 3 days before after the storm comes. Those are kind of some of the things that we're speaking about. So we actually talk about having conversations with Myra Keaton, what they're doing, what can be offered. Those are some of the conversations that we'll be having. But that was a great question. Thank you for that.
From Facebook, I have another question. So what's the plan for the Julius East Brown main campus? It seems like a more feasible location for the Morris DeCastro Clinic.
Okay, so we just spoke about that a little bit in terms of Julius Sproul is going to be moved in terms of expansion. That's a conversation we've already had. We're going to go back, speak with education and see what they're doing. It's going to be bundling in terms of how and when the projects are built. That collaboration is actually going to enhance even more within the next couple of months. It's hard to say exactly what's going on with that area. We know what we have control over. At that point in time, we'll be able to come back and give you more information. I'm going to go here and then in the back, and then we'll go back to Facebook.
Hi, I'm Beverly Lockett. What is the level now? I'm very concerned about the floodplain. What's the sea level?
Well, the building currently, I believe, is roughly existing about 4 feet above sea level. But I believe the required flood abatement level is about 7.
7 is the floodplain level, but you also have to increase it beyond that. So currently, it's about 2 feet. Currently, the existing floor is about 3 to 4 feet lower than it should be per current code. So if we were to build this just as it was, we would have to raise the building up about 5 feet off the ground to protect it, which I'm glad, thank you for bringing this up. At that point, we increased the building height another 7 feet to create parking down there and actually, take advantage of the fact that it would have been elevated anyway. So, really for that extra 7 feet in height, you get all the benefits of the parking.
I understand putting parking there. I'm just really surprised because of all the public meetings I've been to, the issue of the floodplain comes up over and over. So I'm pretty surprised that you're still using this space. I also want to know if you're going to plug into the underground utilities and if you're going to have solar and battery backup. It was quite shocking to go to the open house at the National Park, and they had all these solar panels, but power went out and they don't have backup. Is that part of this plan?
The plan for backup power is a generator on this site, and the reason is because of the facility. The demand is high, the footprint of the building, we could only attain 20 to 25% of the actual load usage. We had our engineers look into that study, and we need full backup, and so generator is the plan for that.
And what about the underground utilities?
Yes.
Well, there currently are the only underground utilities in that area is, of course, potable water, and there's the sewer system that's there. But the power is still overhead. Currently, I know that's, working with WAPA and some of the other federal monies, that's a separate project that we are probably, with the design of this building, going to be ahead of that. But what we are going to be doing is, when they figure out what their plan is, we will ensure that we can accommodate that in the future. But currently, there is no underground power in that area.
I think there was a question in the back here. And you also, let me go. I promised her I would go, and then I'd come back to you, okay?
Who's next?
On the back.
Good evening. My name is Pam Gaffin. I have lots of questions, but I will try to limit it. You are listing 8 different divisions on the second floor that have to do with health, and you're listing 8 different divisions on the third floor that have to do with pushing paper. That's 16 employees. Where are they going to park? And we can't staff what we have now. Why would we believe that you are going to have 16 employees minimum, a budget for that on St. John, when that hasn't happened in a million years on St. John?
Excellent question. Excellent question. One of the things, there's also some of the non-clinical but very important patient areas on the third floor as well, like environmental health. That's on the third floor. So that's not, yes it is. And so it's not wishy-washy. Every entity, every support that Department of Health gives, whether it is on St. John, St. Thomas, St. Croix, it is critical and is important for us to be able to function. Support is just as important as the clinical staff. And so one of the things that we've done in the Department of Health most recently, we've hired a couple individuals. One is a health strategist, and she's only been here for a few months, and she's so far written 3 grants that allows us to hire staff in that area. Right now, we may not have the money from the general fund to hire more people, but what we're doing is linking the federal funds that we get to staffing so that we can actually have those, and it's rotating grants so that we can make sure that we have the staff continuously. It's succession planning, so it's not like we want to just do it for this year and we don't have the money to do it next year. There are ways to do it. We're thinking outside the box and not doing things the same way, ensuring that we have the staff that we need to get things done.
I'm sorry, what you're saying is there is no money for 16 people.
That's not what I said. No, I'm sorry. Just 1 second. Okay, I'm going to ask you to pause for a second because that's not what I said. I said one of the things that we'll do, we have a year to work this out, right? Mm-hmm. One of the things that we've done is we've actually hired a health strategist who's actually sitting and looking for grants, writing grants. So far she's written 3, and she's only been there for about 3 months. Focusing on grants that are actually going to allow us to hire the people that we need, not just on St. Croix, not just on St. Thomas, but also on St. John. Also having individuals that rotate from St. John to St. Thomas, back and forth. But the key areas is that we want to make sure that we have the staff available to be consistent with the services that we know we need to offer. So we admit, I am the first one to admit, we have not been providing as much clinical services that we need to have, but the goal is that we will.
Lanes of traffic that are parked there in the evening, what's going to happen when the construction starts. But maybe we'll have the employees, where will they park? Where are 16 employees going to park? Some are going to come.
A lot is going to come from St. Thomas. Well, right now, we're going to be providing more parking spaces than you have right now. That's just a given, because you don't have the 12 parking spaces under anywhere. So this is what, we're giving you more parking spaces that you have right now. So let me just say, I heard you, and I understand where you're coming from, and I appreciate what your words mean, because some individuals are feeling the same way, and you're speaking it. So.
Years and years and years because you don't have enough money for staff.
And. And
doesn't make any sense to spend $17.5 million, which is $1,521 a square foot, when $1,000 a square foot is concrete cost on St. John, without a floor being parked.
Okay, so I appreciate what you have to say, but let me just tell you all, right, that sometimes you have to build it, and you have to make sure that you have goals and opportunities, and you have to set your goals and make sure you maintain and you achieve those objectives. In the Department of Health, we set goals and we achieve our objectives, and that's what we'll do. But thank you for your information.
Good evening. My name is Jennifer Williams. I worked at DeCastro Clinic for 18 years at WIC. I am happy to see this building. It's the same space. We're going up. There is an agenda to move Morris DeCastro building from Cruz Bay and put what they want there for their gain, their financial gain. We need that clinic in Cruz Bay. We need it. Morris DeCastro, I don't need this thing, what I'm saying? What Morris DeCastro, Myra Keating is the hospital. When you go to the hospital for services, you walk in the door, there is a fee. You walk in the clinic, there's no fee. Years ago, it was $6 for blood control pills at Morris DeCastro, $30 at Myra Keating. The shot, $30 at Morris DeCastro, $60, $90 at Myra Keating. Baby, new infant, wellness, $30 at Morris DeCastro, $200 and change at the hospital. We need Morris DeCastro Clinic. We have people who cannot afford to pay. We need our dental. They have to wait 2 months for dental on St. Thomas at East End. If you have a toothache, you have to bear that toothache for 2 months to get seen at East End Clinic. You all need to stop picking about nonsense. We need Morris DeCastro Clinic. It have a lot of people that don't have that money to pay up at and they're going up there and they're paying it because a lot of them do not know these services are offered at Morris DeCastro Clinic. So they're going to the hospital and they're paying, but that's hospital prices. A lot of us cannot afford it. I see my clients all the time, they can't afford it. I tell them, and I don't have anything against the hospital. They provide excellent service. I've gone there many times. I've taken my family and my children there. But we need Morris DeCastro Clinic and the services that they provide. And we don't need to move it anywhere. It needs to be right there where it's available and where people could get to it.
Thank you, Ms. Williams. Sir? And then we'll go to the lady in the pink, and then we'll go back over here, okay?
Good evening. My name is Joseph Williams. I guess one of my concerns is the staffing, because I realized over the years living in St. John, a lot of time people come from St. Thomas to St. John, and housing is an issue in St. John. So not just for this project, but all these other projects that supposed to be happening. I think somewhere along the line, maybe housing facility needs to be incorporated somehow for the individuals who would have to be working at these facilities, because a lot of times over the years, oh, well, this one couldn't make it from St. Thomas, oh, this, that, the other. So that's a whole other issue that has happened many times. Oh, the lab tech couldn't come today, or this, that, or other, because there's nobody living on the island who is, stable here that could deal and provide these services, work the job. So that's a big problem, and that needs to be looked into with all of this what's going on, okay?
I know that that's one of the things that the governor has been speaking about, is looking for homes, so that not only for the individuals who are living here, but bringing people back from the mainland to come back to work here as well, to come back home. So that's definitely been something that the governor has been speaking about. So thank you for that. I have to say that we have really tried to hire individuals from from St. John, at the Morris DeCastro building. Just recently, I asked them to go back out and look to see if we could have someone from St. Thomas fill a slot, because we had it out 3 times and we were not able to fill the slot. So sometimes it's a challenge, but we definitely try to do it that way. So, but thanks for your comments. And I think that over here, okay.
So we have another
Facebook?
question from Facebook. Is there a concern for this location as it pertains to natural disasters such as tsunamis?
Okay, so that's one of the things that we thought about, and that's why we, in terms of tsunami, that's a little different, but in terms of flooding, that's why we actually built up a little bit more. But the strength of the building will actually speak about tsunami as well. So I'll let you discuss that. Can you?
So I'm glad the question about tsunami came up. Currently in the USVI, we are still trying to establish the tsunami regulations, so they are not in place yet. But one of the things that Springline is going to ensure is that as part of our structural design, the geotechnical work that's going to be prepared for the structure, those things will be considered. So we are planning for that, but right now, none of the criteria for tsunami design exists in the USVI today.
Well, one second, I just want to make sure, you know what I'm going to do? I'm going to ask you to look at people for me so I don't skip, okay? Go ahead.
Hi, good evening. I'd like to know what the timeline is for the overall building.
I'm going to...
When the money runs out. When you have to spend tonight.
Okay, good question. Give me 1 second.
Sure. So the first question was about the timeline. So right now we're focused on the design development, right? And that process normally takes about a year to be completed. But overall, again, this is going to be part of a larger initiative, which is the USVI rebuild, which are committed to providing the contracts to be executed by 2025 for the rebuild. Now, once the contracts are awarded, negotiations have gone through, then we'll be able to get the accurate projection in terms of how long it's going to take to build this type of facility. Typically, just in discussing it with the architects, this large of a structure, once the contractor is ready to go, typically takes about 18 months. But again, that may be reconsidered given the contract that's executed and the contractor that it's awarded to. Your question also about the period of performance. So FEMA allows us to version for scope, and they also allow us to submit time extension requests, right? So initially, the funding is awarded. They provide the initial period of performance. However, based on the development for the design, the award, the contracts that are executed, we provide the project schedules, all the supporting documentation. FEMA reviews it and provides their determination for an extension.
But you don't have a date now when FEMA's money is?
I do have the date, not off the top of my head, because we have 52 projects in our portfolio, but I definitely can get that back and place it online.
Is that within the Department of Health alone, or all of?
Department of Health.
52 projects within
That's
the
just
Department of Health?
within the Division of Project Management and Capital Projects.
Okay.
It's rebuilding USVI. Back and then you, okay?
Good evening, Myrtle Barry. My concern with the planning, is there any plans in place to accommodate the cost of electrical costs, covering the electrical costs for these facilities? Because, you know, I'd like to know also that they'll be able to maintain paying their WAPA bills. Thank you.
You heard about us, didn't you?
I mean, like from a design standpoint, how we're approaching this is that all of the systems in the building will be energy efficient as possible. But I think, like Jerry said earlier, there are some limitations with the actual footprint of the building that just doesn't allow us to bring in some of those alternate energy options. However, our lighting design, all the things, all the systems that we are going to be putting into that building will be as energy efficient as possible, is the only answer I can give you at this point.
Can I have a follow-up? Can I have a follow-up?
Go right ahead.
Because you answered that it's energy efficient, and I really appreciate that. but my real question is I know we're getting grants, the young ladies working feverishly to get grants to cover various costs, which is good, I applaud of that. But I also like to see the Department of Health come in on board and taking
A little bit more green?
responsibility of paying for their WAPA bill.
Oh, are you really getting on that, right?
Yeah.
Yes. I think that one of the things that the governor has actually shown over the last few years that it is important for us to focus on paying WAPA, because if we don't pay WAPA, then everybody else gets hurt. So he's been really focusing on that, and so he's asking each and every one of us to do the same thing. Okay? So thank you for that.
So you have a plan in place? You have, you're going to get a grant or?
Tell me what your name. Tell me your name again. What's your name again?
Myrtle Barry. I just
Myrtle Barry.
hear an answer, and that's what I wanted to answer.
Well, I think it's not just for Morris DeCastro, but for every building, we have to figure out exactly how we pay our bills. At this point in time, money is short all over the place, but it is a focus, and we can't just say that we're not going to pay our bills. So every year, we make sure that we have money set aside to pay our bills. There's a lot of money that comes from federal grants. If you use your federal grants, you actually get some funding that you can actually put aside, and a lot of times we use that to pay our electric bill, as well as other things as well. Okay? So I can give you more information as to exactly what we're going to do in terms of more DeCastro, but that's a start. Right? You happy with that?
I'll wait for your follow-up.
Okay, good. Okay. No, we're going to go here first and then come. Give me 1 second, okay? I'm sorry. Oh. Then we'll go right here to you.
Good evening. I'm
Good evening.
Sally Brown. I'm a former public health nurse on St. John. My question is, are the Department of Health going to provide home care for the community of St. John? Our community, as throughout the Virgin Islands, is going older by the day. There are no provisions. We have no place for our seniors who need to be in residential care. We have no nurses on St. John to go out and look after them. And I'd like to know will this be in your future plans?
Good question. We actually spoke about that a little bit yesterday. We were at the legislature yesterday for our budget, and we spoke about that yesterday. We have a program. It's called the Mobile Integrated Health program, and right now it's mainly on St. Croix because we have some funding that we're utilizing for that to be on St. Croix, and it does exactly what you're speaking about: going into the homes, looking at taking vital signs, taking care of their wounds if wounds are present, trying to avoid them being hospitalized, rehospitalized, behavioral health, assessing that care. So there's a combination of things that we need to do. We did put it in front of the Senate again. We spoke with the governor about it, who should be running that program, how can that program be run, but also expand it to all of the islands as well. So that's important. I always say when I was younger, we had public health nurses going into the homes. I'm a nurse, if everybody doesn't know, so it's near and dear to my heart. It's something that we used to do. It's something that we need to think, and we have actually employed community health workers who can go into the homes, make assessments, and then we have mobile integrated health teams go in there and actually does the actual work. So there's different programs that we have on St. Croix. The intent is to get the funding to be able to have it on St. John and St. Thomas as well. My pleasure.
Evening.
Finally, right?
My name is Cheryl. I work over at Schneider at St. Thomas. I commute from Coral Bay every day, so there are people on St. John that are willing to work here. But we're new to the area. We moved here last winter, and we're not always up to date on what services I guess DeCastro does currently give. Is there room for everyday services in the future build for mammogram, ultrasound, x-rays, where people don't have to go to St. Thomas for those services?
Mm-hmm.
And is there going to be some sort of a clinical setting where doctors from St. Thomas can come over once a month and do colonoscopy interviews where they don't have to travel back and forth, and things that are preventative care?
Those are some of the things that we probably collaborate with Myra Keaton more so on. Right now, I know that the hospital, RLS, has your work there, so I'm sure you've heard about it, but a colonoscopy, you work in it, you see? Okay, there you see, I'm preaching to the choir. So you know that they're actually trying to expand that program. So hopefully they can expand that program and actually work with Morris DeCastro as well, because it is very costly at the same time. So that's one of the things that we can collaborate with them on. Some of the other things that you've spoken about are like minor surgery, and we're not going to be doing a lot of that at Morris DeCastro, but can be done at Myra Keaton because it's also acute care. So those are some...
Not necessarily minor surgery, but mammograms and x-rays and things that...
And
Sorry.
I'm going to say that in Myra Keaton, that would have to be in the future because a mammogram, X-ray machine is portable, it's not that expensive, but you know a mammogram is very expensive. So those kind of things, if it happens over here, it'll also be a collaboration between the hospital and the Department of Health to figure out what we're supposed to do. I have to tell you that I've been speaking to the CEOs as well as to some of the senators as how we can actually improve access to care, especially surrounding emergency when we have hurricanes, threats of hurricanes, those kind of things, because it's very difficult to say that an emergency wouldn't take place in the middle of a storm, and what do we do? So we're working on collaborating with the hospital to see what we could do differently. But thank you for your questions. We have time for one more question. Oh, we'll take two, these two right here, okay?
Yes, I was curious as to whether in, let's say, a long-range plan that you might have, a 10-year, 15-year, or whatever, if you are giving any consideration to having a small facility in Coral Bay. Because in the census, maybe about 10, 15 years ago, I don't remember exactly the year, they said Coral Bay was the fastest growing area in the Virgin Islands. And there's more room for expansion in Coral Bay. So you can't just look at what is, but you have to look at what could be or what will be. So do you have any plans for a small health facility? We used to have a clinic there when I was a child.
Okay, so no plans at this point in time, but actually the Assistant Commissioner Malloy and I were talking about our strategic plan, and redeveloping our strategic plan gets up in 2025. So we need to sit down and figure out exactly what we need to do in terms of public health. We had, obviously, Morris DeCastro had a big vision. He put clinics on all of the islands. We have to figure out how we're going to expand what we have here onto Coral Bay as well. So thank you for that. One more question.
Okay. My wife worked at the clinic 50 years ago, DeCastro. Would it be possible to put any solar on the building? You said it's limited with what to do, but can we be creative so we can pay Myrtle's bill? You said something like there's a canopy around the sidewalk, is that right? Could that be converted into, we gotta solve this situation to be creative because that's important. Even if you had a little bit of solar that with some batteries that could be stored, it's really nice, and critical.
Sure, thank you for the question. And we will be happy to consider that further with the Department of Health. Of course, everything has cost-benefit analysis, so our initial study by our engineers, just the number was very low in terms of what we could actually produce in comparison to the demand, but every little bit helps. So we'll definitely get that point. So we'll consider that further as we go and see if it can be integrated in the design and see if it makes sense.
Okay, I have two hands and only one more question. I am not going to ignore Myrtle, so I'm going to go to you, and Myrtle is going to be the last question, okay? Okay, so go ahead.
I'm just wondering if there is a lab, X-ray technician up at Myra Keating right now, or if there, I'm told there isn't. Is there plans to have one up there, please?
I wouldn't be able to answer that question, but I can make sure that answer is given to you through the CEO of the hospital, okay? For a long time? Yeah. I will get back to you, and I'll make sure that that's something that she, and maybe you could help us, Shakima, if you could help us get that information.
So the X-ray technician, he retired. And LS Roshana Hospital is in the process of looking at interviewing individuals. We have 3 so far that is being interviewed. So it's just a matter of time before that position is filled, hopefully sooner than later.
Thank you for that, Administrator. One more, Myrtle, you're the last. One more on Facebook.
Has a traffic study been done to show real data that this is the best location to house ambulances when the area is already congested?
That's an excellent question. I should have not asked you to answer. Hold on, okay?
No, admittedly, we have not done any traffic studies, but I think that's a conversation that we can have with Department of Health now that the question's been asked, to augment that and bring that consultant on board if necessary.
Great question. Thank you. Gives us some homework to do. So thanks for that. Myrtle?
Thank you for entertaining this question. You mentioned $17.5 million being awarded for this project. Which one of you fine gentlemen is a contractor? None? Okay, no. So I'd like to put on the floor something for you to look into. $17.5 million. Can we get a 20-year warranty on that building from leaks and cracks and stuff that go wrong? Thank you.
Sure. So I'll hand it over to Springline Architects just to speak about the specifications and the possibility of including warranties in them.
I get all the easy ones. It's a good question. In terms of the design and specifications, many of the products assemblies do actually come with 10, 15, 20-year warranties, and we can look for opportunities. You can sometimes get extended. As far as the building as a whole, that's just not industry standard to come with some type of warranty, but we are going to design the building to not leak. We're going to design the building to withstand the storms. We're going to, through good design, help ensure, without a warranty, overall building warranty, that the building will service you for many years to come. So that's just our general approach.
And I'll just follow that up to say that, Springline, we've been here for 25 years designing in the Virgin Islands. Just about every building that we designed made it through Irma Maria. A couple of those buildings had some impact damage due to flying debris, but majority of all of the buildings survived. So we feel up to the challenge that you've now presented to us. Because it's 2 major different entities, and I'm tired of government stuff with expensive stuff.
But I have to tell you, Myrtle, one of the things that we're doing is we're also having a contract, a manager that is linked not with the contractor, but with Public Works or one of the other companies to ensure that the work is being done the way that it's supposed to be done. So it's monitoring and as well. So we've done that for other projects, and we'll continue to do that. I want to take the time to say thank you, thank you, thank you. This has been an awesome experience. We will take the information back. We have heard you. We will listen to you, and we will come back to once again share progress. Thank you. Everybody have a wonderful night.